Riverside Pain Physicians.
You want to talk about hearing? I will be singing that song now for the rest of the afternoon. It's one of those things that gets stuck in your head, doesn't it? Okay. Are you or a family member suffering from some sort of chronic pain, just a generic pain that just does not seem to be going away? Dr. Jimenez is with Riverside Pain Physicians, and he helps patients manage symptoms, and he has some tips for pain prevention and also treatment. Thanks for being here, Dr. Jimenez.
Thank you for having me again here.
So when you see a lot of patients come into your office, what do you see as some of the biggest causes for the chronic pain, or where are those chronic pain areas located? You see?
Yeah, the most common that we see in general, all my colleagues, even ourselves and other colleagues anywhere in the country, is back pain. Yeah. Lower back pain is so common, it's ridiculous. Everybody's dealing with that on a daily basis. I think up to 70% of the population eventually will have a back pain episode.
Yeah, and so when you're talking about back pain, what can we do to try to prevent that, or is it just an inevitability that we're going to suffer from it sometime?
Yeah. So the research have shown that basically the changes in the way that we live and the activities that we do, being sedentary too much, being sitting for too long, not working what we call the core muscles, is overloading basically the lower segments of the lower spines.
Yeah,
That's usually what's hurting.
Yeah, so if someone were to come to see you and they say, I've just got a pain in my back that I can't get rid of, and you know, the other thing too, I'm sure they have concern with repeatedly taking pills or acetaminophen or anti-inflammatory or Motrin or something. How can you help then relieve that pain, or really any generic lagging pain?
Yeah, so essentially we have to approach every patient separately. There's not like a cookbook recipe that we can use or do to solve the problem. We usually talk to the patient first, have a conversation like the way we're having right now, getting to the bottom of the issue and have all the qualities and the descriptors that we need to elaborate a plan to diagnose where the pain is coming from. Once we reach that, we can order certain tests. There are several kinds of tests, MRI, CT scans. People have heard that. Now we don't do just scan. We don't do imaging, because up to 30% of population will have findings and they don't have pain, which is a big issue. Yeah. So we don't go, oh, you have a herniated disc, we have to do this. It depends on how we correlate the exam with the clinic.
Yeah, so you really, it's a case-by-case basis.
It's a case-by-case.
And you go just beyond just a little readout
Correct.
or print. Yeah,
Correct.
Work with them.
Yeah, we all take every case separately. Physicians will talk to the patient and examine the patient himself.
Yeah, okay. And another thing too, walk somebody through too, if they were to come into your office, like what they could expect as far as you know, getting a general workup. You know, would they go and would they meet with someone such as yourself? I know you have anesthesiologist obviously on staff. How does it work? Yeah,
it's kind of a mystery. People think that, oh, pain clinics, you know, I'm afraid of going there. It's actually, we're specialized in this field, and we approach the patients like any other physician. We have to talk to the patients, get a history, then we examine, we focus examine, depends on the history, and then we elaborate the treatment plan. It's very simple and very easy to do. And
how do you see the reaction, or what do you think of the reaction of some of the patients that come in your office that have waited to do something about the pain because they were so afraid to go to a pain physician? You know, they just dealt with it, but then when they have relief to their pain, it's just, you know, life transforming.
Yeah, many patients say, like, I should have come much earlier. You know, I've been dealing with this pain for years and years and years, and it was so easy to deal with.
Yeah.
Not the majority. You know, the majority of patients think that, oh, I have chronic pain, I have to deal with it, I will never get better, and that's not the case.
It's just part of getting older. I just got to deal with it.
Yeah, that's what they think.
Well, and then to get your life back too. I mean, to enjoy the things I'm sure that you once did a lot of, playing golf, playing tennis, and then to be able to go back and do those things, I'm sure is just fantastic.
It's recovering their life, pretty much.
Yeah. So talk a little bit about your background too, because you've been on the show before, but how did you get involved in this kind of field?
So I did basic training. Initially, I did general surgery to go into anesthesia. Once I got into anesthesia, I started seeing that interventions and procedures were making patients better. We do nerve blocks for surgical procedures. And then I just got in love with the fact that we can change somebody's life so easy.
So this is truly a passion for you.
Yeah, so I like it. I like to make somebody better, and they're able to enjoy life.
Yeah,
you know?
Well, that's what it's all about, making it all worthwhile, making sure your body feels good so you can go do the fun stuff.
Correct.
All right, Dr. Jimenez, thanks so much.
Thank you for having me here.
We appreciate that, and thank you so much to Riverside Pain Physicians for coming on and sponsoring this segment. For more information about pain management, the physicians, their locations, you can go to riversidepainphysicians.com, or you can call them. The number is there on your screen, which is 904-389-1010. Well.